Great. So now I start with your story. Okay, just 45 minutes we'll discuss about the theory in depth, one topic with full concept, and 15 minutes we'll titrate ourselves with some MCQs. Okay, just a minute. Just a minute. Yeah, now it's okay. Right. So I'll go with the story. Yes, nowadays we are getting a question like this. Based on this, we'll fix which topic we are going to discuss. Okay, you are also aware of that. A 5-day-old infant. So it's something neonate. If you see the question first time in the exam, you may think of some pediatric case. 5-day-old neonate brought to the emergency department because he won't stop crying and he won't wake up and eat. Lethargy and continuous crying. Mother was concerned and sought medical care when she realized the baby had fever. Sure. The baby was born full term and the mother reports that the pregnancy was uneventful. Okay. But she did have a bout of flu for a few days when she was 8 months pregnant. So at that 8 months pregnant, she had some fever. But okay. Flu-like fever. Infant's temperature is high. On examination, the infant is irritable. Every word is important. Crying and inconsolable. Continuous crying. Irritable. That is important. Tachypnea is noted and the clinician observes that the baby's anterior front tunnel is full. Bulging front tunnel. Lumbar. So immediately up to this stage you can think of some problem in brain. Everybody think it's case of meningitis. Yes or no? I'll directly go to the diagnosis. Clinical is diagnosis. Okay. A lumbar puncture is performed and after 2 days, a beta hemolytic organism is recovered on blood agar. So immediately neonatal meningitis, beta hemolytic organism. Our mind go to somewhere. Immediately we think of causes of meningitis and that also beta hemolytic. Immediately our mind, usually we go to normal, most common causes, GBS. Group B beta hemolytic streptococcus. Yes or no? Yes or no? A gram stain of the pathogen is shown in the image. Yes, that is the diagnosis. Gram stain of the image. It is gram positive bacilli. It's not cocci like this. It is like this. So purple color, it is like this. So gram positive bacilli. Which test was best aid in confirming identity of the most likely pathogen? So clinically you identify this as a case of meningitis. That also neonatal meningitis and gram positive rods present. And which test is ideal? Many people say streptococcus pneumoniae, GBS, anything. But GBS is gram positive cocci. This is gram positive bacilli. First confusion. Okay, gram positive bacilli also causes neonatal meningitis. For example, Listeria monocytogenes. Okay, gram positive bacilli. Number 2. Okay, if you identify as Listeria monocytogenes, what is the test used to diagnose? Production of metachromatic granules? No, that is commonly seen in Corynebacterium diphtheriae. Agglutination with antibodies to Lancefield group B. Yes, that is mainly for GBS, group B beta hemolytic streptococcus. Streptococcus agalactiae. Formation of clot with rabbit plasma. This test is called coagulase test. Coagulase test mainly for Staphylococcus aureus. CAM test. No, because Agalexia produces arrowhead pattern. I'll show the image. Everything I'll show the image. Next 25 minutes, 30 minutes, I'm going to discuss only this. Okay, right. So here you can choose. It is a case of neonatal meningitis caused by Listeria monocytogenes due bacilli. CAMP property, CAMP test. Everybody think CAMP test means GBS. No, other people also CAMP positive. Some people reverse CAMP positive. Some people modified CAMP positive, like that. So CAMP test with blockhead pattern, not arrowhead pattern. I'll show the difference. Got it? So now we are going to discuss case of meningitis. So meningitis. Everybody knows it is inflammation of the meninges. So if we take the brain infection, we have three types. One is meningitis. Another one is encephalitis, inflammation of the brain parenchyma. And brain abscess. These three are the major types of CNS infections. We shortly call brain infections or CNS infection, only three. Easy. Meningitis. Another one is encephalitis. Another one is brain abscess. Got it? Next is, I got a question. So Listeria common, least common or most common? We need to go according to the question. Gram positive bacilli, even though it is the least common, even one case, if they ask the question, we need to answer. Okay, how to diagnose, conclude meningitis? Number one, clinical diagnosis. Number two, supportive, lab diagnosis. Supportive, either lab diagnosis and also imaging. First, you conclude with clinical diagnosis. After suspicion, you confirm with some of them with imaging techniques, CT, MRI, like. Another, lab diagnosis. Lab diagnosis, all three departments are helping you. It is including biochemistry, pathology, and finally my department, microbiology. Microbiology. Okay, just 1 minute you can remember. Suppose in case of case history, when you suspect, think of meningitis, you are come across some important key points like patient is having headache, fever, vomiting, altered sensorium, abnormal behavior, unconsciousness, fatigue, neck rigidity, bulging frontal in case of neonates, bulging frontal, irritable, cry, okay, sometimes convulsions, blurred vision, yeah. When these kind of features, not all, majority of the findings comes, you immediately think of it's a case of CNS, mainly meningitis, because it's integrated class and some integrating clinical points also, don't worry. So step one, after reading the clinical case scenario, you need to conclude which system. So now its system Palcom is for Listeria, yes, some discussion is going there. Okay, cool. Okay, once you diagnose as clinical diagnosis as meningitis, meningitis, you need to know how to classify meningitis. It is important. We are classifying the meningitis, number one, based on the time period. One is called acute meningitis, another one is chronic meningitis. Based on the time limit they give in the history. Second important, acute and chronic meningitis. This is based on the time. Second, based on the cells which is present in the CSF. One is polymorphonuclear cells present. We call it as pyogenic meningitis. Majority of the bacterial meningitis are pyogenic. Another one is lymphocytes present. We call it as aseptic meningitis. Aseptic meningitis. Aseptic meningitis. Polymorphonuclear cells, lymphocyte, aseptic meningitis. Next is number 3, based on the etiology, that is microbiology. Based on the etiology, we can say whether it is bacterial meningitis, which bacteria, or viral meningitis, which virus it causes, or fungal meningitis. And don't forget, rarely you can get parasite also. So this is etiological diagnosis. Any meningitis, please you think of bacteria, virus, and this thing. Just a minute. I'll open my door because of the net problem is there. Just a second. Okay, thank you. Some people are having stuck problem. Now you won't get stuck problem. Don't worry. Got it? So etiology. This is very important. This is the way you need to approach a case. Okay. Now, in case of meningitis, all the things are, whether it is pyogenic or aseptic, or it is bacteria, viral, fungal, parasite, everything is decided by laboratory. So, number 1, the ideal specimen is CSF. There was a question they asked 4 years before. How many CSF samples you are going to collect? You can aliquot. One time you are collecting the CSF in aseptic precaution. How many aliquots you are going to do? There are 4 aliquots. One for biochemistry, order of drawing. Another one is for hematology. Next is for serology and microbiology. This was the question they asked, very practical question. This is very practical question. Okay, very practical question. Somebody says 3, somebody says 4. Janvi says 4 and Rajat says 3. See carefully here. So, this is the order of collection. Order of tubes. First one you can give chemistry or immunology. Used for chemical and serological test. Even you can give in frozen temperature, no problem. When you give for microbiology, it should be in room temperature. You should not refrigerate because many pathogenic organism causes meningitis. They are cold sensitive. If you keep it in cold temperature, they will die. Haemophilus influenzae, like many organisms. So better you collect the CSF, keep it at 37 or room temperature. Next is for hematology, you can get the cells. Used for cell count, for refrigeration. Okay, 4th tube, maybe if for exclude contamination, for additional serological test, any special test like PCR or something, you can go for molecular test, you can go for it. If you want to get glucose, you can use separate fluoride container, that are aware of that. So, at least minimum we need to have 4 aliquots. 4 aliquots for CSF specimen. Okay, come back here. First, if we send it to biochemistry and hematology, based on the biochemistry and hematology, you can say it is viral or bacterial or fungal. Etiology. How, sir? This table will help you. We are going to deduct proteins, glucose, cells, and at the time of opening pressure. These 4 parameters are important. Glucose, proteins, cells, and opening pressure. These 4 parameters will give an idea whether it is bacterial or viral etiology. Whether it is bacterial or viral etiology, it will give an idea. Okay, see carefully here. Yeah, this very important slide. CSF profile in meningitis. Sometimes they will give the value or high protein or low protein, like that they will give. It gives an excellent idea to you to choose which one. For example, high protein, drastic reduction in glucose with polymorphonuclear cells. Opening pressure is increased. You can say it is bacterial meningitis. Any bacterial meningitis 90%, this is the common protocol. Suppose protein is mildly increased or usually normal, glucose is usually normal, you are getting lymphocyte and pressure, everything is normal. It may be viral meningitis. Mild elevation in protein, mild reduction in glucose, lymphocyte, and opening pressure is fungal. Same protocol, tuberculosis. You can have high protein, low glucose, lymphocytes, and pressure. Okay, almost the 2 protocols are same, but tuberculosis you can get cobweb coagulum. You can get cobweb coagulum. Yes, great tube for glucose. Sushma Amli, yes, I'm seeing your thing. Okay, cobweb coagulum. Got it? CSF profile in meningitis. Based on that, sometimes in the exam they will give the value. You should know at least the value of what is the common CSF glucose level normal, what is the normal CSF protein level, like that. At least you should know some things, that this table will help you. Because normally protein will be 15 to 50. Okay, and bacterial meningitis it is highly increased. Glucose 45 to 85. It will be decreased less than 45. Okay, and white blood cells less than 5. Okay, right. So this is, at least you should know the normal value. Sometimes they may give the value. Protein, glucose, CSF value they can give. Right. So based on the value, opening pressure, you can come to conclusion it is which type of meningitis, whether it is bacterial or viral or tuberculous or fungal, you can make it. Another important thing, predisposing factors. It's very important. This is the clue, trump card of any question. This is the trump card of any question. They will give 6-day-old child, neonate, that neonatal meningitis. If they give 60-year-old man, old age, in case of HIV positive, PLHIV, or in case of after surgery, like that they give some important clues, that is called predisposing. This is important, you must know. If you know this, you can answer the question. First you need to identify the organism, that's a part 1. Second, after identification, something they related to organism, they will ask the question. For example, if the cryptococcus means what is the treatment, what is the selective medium, like that they will ask. If a bacteria means, they will ask what is the culture medium, what is the colony morphology, what is the vaccine type, something they will ask. Before that you need to ensure your organism is a correct organism. For that, very important point is predisposing factors. Predisposing factors. The number 1 fellow is age. Based on the age, you can get 60 to 70%, you can get near the organism. After diagnosing it's a fungal, bacterial or something, some pathogen, you can easily identify. I'll give the example of predisposing factors. See carefully. Number one is age. Based on the age, see carefully here. Yes. In case of newborns, neonates, GBS, E. coli, Listeria. In India, you can add Klebsiella pneumonia also. But universally, these three people, GBS, E. coli, Listeria, the mnemonic is Bell. 6 months to 6 years, we have Streptococcus pneumoniae, Neisseria meningitis, Haemophilus influenzae, and some enteroviruses. Enteroviruses are very common, causing aseptic meningitis. Streptococcus pneumoniae, meningococci, pneumococci, meningococci, Haemophilus influenzae. We call it as NHS organism. And adult 18 to 40 years, same Streptococcus pneumoniae, Neisseria meningitis, and virus, herpes virus and enteroviruses. Seniors 40 to 65 years, Streptococcus pneumoniae, Listeria monocytogenes. So after 6 months, Streptococcus pneumoniae is one common fellow causing meningitis. In adolescents is Neisseria meningitis. Old age, Listeria again comes. Listeria comes in both extremes. One is a newborns, another one is very old age. And immunocompromised, anybody can cause, but immunocompromised, common, we are seeing HIV positive, Cryptococcus neoformans, and even Streptococcus pneumoniae, Listeria, cytomegalovirus, many people can cause. Toxoplasma gondii, it is commonly with brain abscess and what's called encephalitis. Aseptic meningitis caused by usually viruses mainly. Enteroviruses, HSV1-2, many viruses, and some parasites like Naegleria fowleri, West Nile virus. These are all causing Cryptococcus neoformans. It causes pyogenic meningitis as well as aseptic meningitis. Okay. Next is, or you can see like this, very simplified form. All are same. Fungus, Cryptococcal neoformans, commonly seen in PLHIV. Aseptic, Coxsackie, Echo, mumps, and polioviruses. These viruses usually cause aseptic. Some bacteria also. Even Leptospira causes aseptic meningitis. And old age, always think of Streptococcus pneumoniae and Listeria. Above 65, up to 60 you can get Neisseria meningitis, these people. 6 months to 6 years, same. And almost, if you know this etiology based on the age, this is important, repeating. If you know the age perfectly, age with the agent, remember, age versus agent, I call like this, rhyming. Age versus agent. If you know the correct age with the agent, that's all. 80% you near the diagnosis. 80% you can near the diagnosis what it is. Once you near the diagnosis, once you identify the organism, after that you should know about the organism. That is core microbiology. That is called core microbiology. For example, in case of Streptococcus agalactiae, or Listeria monocytogenes, or E. coli, how to diagnose, what is the virulent factor, what is the toxin, that is core microbiology. Apart from that, other predisposing factors, one is age, next is other predisposing factors. This table is very important. Other predisposing factors, other clue. People call it as predisposing factors. I love to call this as clue. This gives, the clue gives, without clue you cannot identify. See, another important clues, see carefully, yes, this is important. In case of neonate, you are all aware of that, Streptococcus agalactiae, E. coli, Listeria, we call it as Bell. In case of young children, Streptococcus pneumonia, Neisseria meningitis, Haemophilus influenzae, 6 months to 6 years. Young adults and old adults, Streptococcus pneumonia, Neisseria meningitis, herpes, this all we completed age-wise. In case of immunocompromised, think of Listeria monocytogenes, Pseudomonas klebsiella. Pregnancy, Listeria common. That is a cause for neonatal meningitis. Neonatal meningitis. Okay, in case of any splenectomy patient, think of Streptococcus pneumoniae, splenectomy. Not only Streptococcus pneumoniae, Klebsiella pneumoniae, many other. Complement deficiency, C5b to C9. Terminal complement, all Neisseria infection, which include Neisseria meningitis. Any neurosurgery, Staphylococcus aureus, any ventriculoperitoneal shunt or any prosthetic, think of epidermidis. I tell you always in the class, any prosthetic, staph epidermidis, any post-surgery, Staphylococcus aureus. And HIV positive, even immunocompromised, mainly HIV positive, Cryptococcus neoformans. The history of swimming in the pond, Naegleria fowleri, it causes amoebic meningoencephalitis. History of mosquito bite is West Nile virus and some other arboviruses. Tick bite, Borrelia burgdorferi, neuroborreliosis. And sexually transmitted secondary syphilis or tertiary syphilis, Treponema pallidum. Sexually transmitted syphilis, disease syphilis, or endemic. So sometimes they give the history of California fever is Coccidioides immitis. It also causes meningitis. These are all the possible predisposing factor. If they give after ventriculoperitoneal shunt, immediately the first mind should be go for staph epidermidis. Suppose HIV positive meningitis, think of Cryptococcus first. Apart from that, think other people. In case of complement deficiency, think of Neisseria first. Okay, nicely Sushma mentioned capsulated organ. Yes, in post-splenectomy, any capsulated pathogen. Yes, correct. So this is called predisposing factor. Based on the age, based on the predisposing factor, based on the lab value, you come to conclusion of the organism. Once you identify the organism, then you need to play according to your existing knowledge. For example, in case of Streptococcus agalactiae, if they know, you should know at least 4 to 5 points. It is gram positive, cocci in chains. It's commensal in female genital tract. It's the most common cause of all neonatal infections, usually general rule, and it is CAMP test positive. Everybody knows Christie, Atkin, Munch, Peterson. CAMP test positive. It produces arrowhead hemolysis. But if we take Listeria, you should know it exhibits tumbling motility, gram positive rod, tumbling motility. Mode of transmission, eating cheese or milk dairy products, unpasteurized dairy products by mother, tumbling motility, jet actin motility. Somebody nicely mentioned when you say Listeria, Palcum medium. And it also CAMP test positive. It also CAMP test positive. But it produces block hemolysis. This is called modified CAMP test. Oh my God. So both are making CAMP test. CAMP test positive means both. Because of the reason to the first question, that when we discussed the history, some people got confused. Many people answered it's GBS. I'll show the image. You won't forget. Yeah. See here. Yeah. This is Staphylococcus aureus. which produces beta hemolysin. Up to this area it produces beta hemolysin. And this is Streptococcus agalactiae. It produces arrowhead hemolysis. See, arrowhead hemolysis. Same picture I am showing both. Then only you will not get confused. In case of negative, there is no hemolysis. There is no enhancement of hemolysis. But if you take Listeria monocytogenes, it produces square color. Square, see, it produces typical square. It produces typical square. This is called block hemolysis. Blockhead hemolysis. Yes, you are right, Swati Roy. Modified is CAMP and LTOR. Vibrio LTOR and CAMP and Listeria produces CAMP test. But sometimes they will ask reverse CAMP test. Sometimes they will ask reverse CAMP test. Reverse CAMP test positive for Clostridium perfringens. Reverse CAMP test positive for Clostridium perfringens. Reverse CAMP test. Got it? So CAMP, modified CAMP, reverse CAMP. So today you got some new points. So like that you need to know what important test and important medium for each one. For example, carefully see here. Yes, great. I will take some important. So Streptococcus agalactiae, you can go for CAMP test. Listeria monocytogenes, the key point is tumbling motility. E. coli, Escherichia coli. It's a very common agent. It grows, it's a lactose fermenter, motile, lactose fermenter. The important medium is Meconic agar. For meningitis, you can use just Meconic agar because CSF is sterile fluid. In case of Streptococcus pneumoniae, it exhibits Kollang reaction. Remember the mnemonic bio, bile solubility, inulin fermentation, and optochin sensitivity. Yes, should be. Slowly if you see, you can enjoy. So Streptococcus pneumonia means they will ask, these are the important microbiological point. Kollang reaction, bile solubility, inulin fermentation, optochin sensitivity, carom coin colonies. These are all the keywords. Every organism know 4 to 5 keywords. Carom coin colonies, it is lanceolate shape, splenectomy, all comes under. Neisseria meningitis, you should know 3 to 4 points. Neisseria meningitis, it is lens shape, capsulated. It usually affect adolescent people. Important complication, it produces petechial rash. That is important. Adolescent people, overcrowding adolescent people, petechial rash. Waterhouse friction syndrome, do not forget my dears, Waterhouse. Waterhouse friction syndrome, these are all. And it ferments only, it ferments glucose and mannitol fermentation. It causes adrenal damage, all other things and all. So if you think of, I'm not going to teach full. This is the key point. Haemophilus influenzae, another important pathogen. Haemophilus influenzae, you should know 3 to 4 points. It needs factor 5 and factor 10 growth factor. Factor 5 and 10 growth factor, that is a key point. In children and adolescents, even adults, it causes meningitis. An important selective medium, Fildes agar or Leventhal medium. Type B is more virulent because it contains polyribosal phosphate, PRP, polyribosal phosphate. Polyribosal phosphate. Yes, beautifully people are answering. I'm so happy. Okay, like that. Poliovirus, no, don't worry because not in India, but it causes aseptic meningitis. Coxsackie virus causes aseptic meningitis. Coxsackie virus, all echovirus, all these people causes aseptic meningitis. Cryptococcus neoformans, what you should learn? It is yeast. You should know India ink. Mucicarmin stain. Virulent factor is capsule. Another one is melanin. And the medium is birdseed agar or Niger seed agar. Birdseed agar. These are important points about Cryptococcus. And it's seen in pigeon droppings. And it's the most common cause of meningitis in HIV positives. And please remember, apart from that, any other special investigations are finally RT-PCR, ELISA, any other investigations, important investigations are there. Okay, right. And usually meningitis is, majority of the meningitis diagnosed by antigen detection. By latex agglutination test. They will ask, one time they asked the question, I am teaching many things based on past experience of asked, what are the questions they asked? Latex agglutination. It is called yes, a COT test, rapid COT test, bedside test, bedside. A test card will be like this. The company wala gave circles, different circles. They gave the name A, B, C, D, E, F, like 6 tests, 8 tests, 10 tests available. Add 1 drop of CSF and 1 drop of the reagent. Mix it. If you are able to see clumps, agglutination, that is positive. In this test, B positive. So they give the clue. A, Streptococcus pneumoniae. B, Haemophilus influenza. C, Cryptococcus. D, Neisseria meningitidis. Like that, they give panel of organisms. So one test in bedside, matter of 5 minutes, you can find common pathogen. If any common pathogen, immediately you can diagnose, then go for treatment. Aditya, Neisseria meningitidis is maltose. Please remember, it ferment both glucose and maltose. Gonococci only glucose. We used to teach always G for G, gonococci, glucose. M for M, meningococci, glucose and maltose. Because maltose is 3rd standard, glucose is 1st standard, for example. So if we pass 3rd standard, automatically pass 1st standard also. So meningococci, maltose, gonococci, glucose, no mannitol. Okay, right. It's not mannitol, it's maltose, sorry. Glucose, maltose. Glucose, maltose. I'm sorry. It's glucose, maltose. Please remember, it's not mannitol, my dear. Glucose, maltose. Please, I'm repeating. I'm typing here also. It is maltose. My slip of the tongue. Okay, now I accept. I change that. You also change. Okay, right. Thank you. Yes. So once you diagnose either by gram stain or acid first stain or culture media, colony morphology. Yes, the diagnosis, what are the clues they can go? Diagnostic clue, culture, colony, or gram stain, acid fast stain. Next is sometimes they give serological test. It is positive for IgM cryptococcus, like that they can give serology. Sometimes they give molecular test, RT-PCR. Or sometimes they make you some biochemical test. For example, urease positive, like cryptococcus is urease positive, like that biochemical test. Sometimes they may give imaging. We can see ring enhanced lesions, like that they will discuss. Okay, right. Ring enhanced lesion, like that they can give some sort of diagnosis. So you can confirm the diagnosis here. So based on the history, based on the predisposing factors, based on the laboratory reports, you conclude all the three, then you can get strong diagnosis. This is the organism. And finally, sometimes they may ask about the treatment. I'll give the clue. Majority of the bacterial etiology treatment is ceftriaxone. Majority, I'm not saying 100%. Majority treatment bacterial etiology is ceftriaxone. Prophylaxis, ceftriaxone. Some books are mentioning ciprofloxacin. Old books are saying rifampicin. Okay, so prophylaxis is ceftriaxone is the very good prophylaxis. Ceftriaxone, ciprofloxacin, and rifampicin. But now rifampicin is not recommended. Still some books are mentioning. Yes, Aditya, it's our fault. We accept. We change it to maltose. What given in the class is right. Now by INICET, I'll did something wrong, but I'll accept it. Okay. And international, rectified immediately because of you people. Now you people are teachers, right? Because if you study strongly, stand with your decision. Argue. As per my knowledge, this is right. Why you say like this? Good. Next is, in case of virus, viral meningitis, especially herpes, acyclovir. In case of fungal meningitis, cryptococcus, even Naegleria. These people you can go for amphotericin B. This is the treatment. Okay. So now you have the idea. What is meningitis? What the classification, acute, chronic, pyogenic, aseptic, etiological. How to diagnose, clinical picture. Important predisposing factors lead to the organism. And how to do lab diagnosis, CSF. What are the clues, lab values, culture, and each important things. Okay. Right. Next is, listen, some questions we'll discuss because exactly 1 hour I'll finish. Okay. Right. Some important questions we'll discuss. Each question will have some its own clue. Yeah. I made 5 to 6 questions. Start with easy, then go tough. Every question is easy. 23-year-old male adult admitted with signs of meningitis. You are very lucky. They themselves give the diagnosis meningitis. So your 60% of your job will be over. No pus cells and microorganisms found. In CSF microscopy. Culture negative for bacterial and fungus. So no pus cells. It's not polymorphonuclear. No pyogenic. No bacteria. No fungus seen. So the physician diagnosed as aseptic meningitis. Great. That's all. CSF PCR viral etiology revealed picornaviridae. All the following will cause aseptic meningitis except okay, picornaviridae. What are the viruses in picornaviridae? There is a famous mnemonic called percha. for picorno. You see in my group, the mnemonic side will be there. What are the viruses belong to different groups, viral families. Each viral family contains many viruses. Picornoviridae is polio, echo, rhino, Coxsackie, and hepatitis A. These 5 people belong to Picornoviridae. All Picornoviridae causes meningitis except rhino and hepatitis A. Except these 2 people, all people causes meningitis. So polio causes, Coxsackie causes, echo causes, except rhino. Except rhino. Okay, answer is A. Percha. Yes, should be. Beautiful, beautiful. Okay, next. See the question size. A 2-week-old boy, game over, neonate, brought to the emergency department by his mother for poor suckling. He has been lethargic since yesterday and has hardly made any sound. His birth history was unremarkable, but his mother did not have any prenatal care. She has a history of rheumatoid arthritis treated with methotrexate, immunosuppressant. During questioning about her pregnancy, the mother says that it is soft cheese during gestation and that she changed her cat's litter box occasionally at home. Confusion. Because soft cheese, I can go for listeria. She is having cat, I can go for toxoplasma. Yes or no? Yes, yes, my dear. Enterovirus is a part of picornovirus. Yes. Aditya. The child's temperature, overall we call it as enterovirus. We call it as enterovirus 72, 70. Each one comes under enterovirus. Okay. The child's temperature is very high. Blood pressure is very low. Shock. Pulse is 180 and respiration 60. Almost shock. Physical exam reveals poor tone diffusely but no focal neurological deficit. Lumbar puncture performed. Analysis of CSF reveals gram-positive cocci. Which are the following most likely to prevent the child's infection? First you come to conclusion. It is neonatal meningitis, my dear. It is neonatal meningitis. Accepting or not? Yes. But it is not listeria. It is not toxoplasma, which we are thinking. Because it's cocci. That's one point is over. Microbiology department put full stop. It is gram-positive cocci. Gram-positive cocci, one and only GBS. Yes, beautifully mentioned. Who mentioned? Yes. Hope and Shama. Okay, GBS. Great. So how to prevent the infection? GBS. Abstaining from eating soft cheese. It is for listeria. Maternal vaccination with polysaccharide vaccine. Maybe meningococcal in case of she is having meningococcal infection. Maternal immunosuppressive therapy. Cessation of maternal baby. Already she took the treatment. That cannot prevent meningitis. Okay. Avoiding cat feces during pregnancy for toxoplasma. Okay. So, in case of mother, every mother antenatal care, when at the time of 36 weeks or 35 weeks, we do the rectal swab and culture as vaginal swab. If she is having group B streptococcus, we need to give prophylactic administration of penicillin. That is important because the mother is not having any antenatal care. Okay, prenatal care. Because of she is not having any prenatal care, the child is more prone to get GBS. That is the reason. Got it? Great. Next is otherwise healthy 24-year-old man presents with 24-year-old adult. Okay, 5-day history of painful lesion on his penis. Painful lesion on his penis. I can't go for syphilis because syphilis is painless. An adult painful lesion on the penis. Additionally, he complains severe headache, fever and neck stiffness, meningitis. Man sexually active and currently has several partners. So sexually transmitted disease, ulcer on genitals, painful, meningitis. He has not recently traveled outside United States because he's from US. A scraping from the base of the lesion and CSF obtained. CSF shows lymphocytic pleocytosis. Lymphocytes, so not polymorphonuclear. Which are the following most appropriate management for the patient? So after diagnosis, you need to know the management. I say it is viral etiology, it's not bacterial etiology because it's painful ulcer and aseptic meningitis. It is due to herpes. Mainly herpes. Okay. And treatment is acyclovir. Treatment is acyclovir. Treatment is acyclovir. Next is, very good. A 19-year-old man presents to the emergency department with fever and lethargy. His girlfriend states he appeared normal to prayer evening, but he had complaint of severe headache. Wherever headache, first think of CNS. That morning, she found him in bed moaning and complaining lethargy and neck pain. His history is significant for splenectomy following motor vehicle accident 2 years. Splenectomy, meningitis, 3 people. NHS. But read the question full. At the time of examination, his temperature is very high. Addition, knuckle rigidity and purpuric rash on his legs and trunk noted. Rash, purpuric rash, knuckle rigidity, meningitis. So now you tell which organism. It is Neisseria meningitidis. But don't go to the answer. Read the question fully. CSF obtained, gram stain demonstrated, gram negative cocaine pairs. Great. My diagnosis right. But see the question. In addition to the most likely agent causing the infection, this man is increased risk for developing an infection with. See the question. Beautiful question. They are not asking Neisseria meningitidis. Splenectomy patient. Now he got Neisseria meningitidis. But same kind of infection, he is more prone to get which type of infection? He is more prone to get which infection? Yes, which infection? Any capsulated pathogen. Any capsulated pathogen, he may develop other capsulated pathogen. Here is Klebsiella pneumoniae. He is more prone to get Klebsiella pneumoniae infection because it is very good random chicken. Name is different but good. Klebsiella pneumoniae. Got it? Because all your work identify this as Neisseria meningitidis. After that you need to correlate. Splenectomy patient, he may develop any capsulated pathogen disease. Now he developed already meningococci, but he may be prone to get any other capsulated, even Streptococcus pneumoniae, yes. Even Haemophilus influenzae, yes. Great. Next is, it's a little big question. A 40-year-old HIV positive woman presents to the emergency department with a 1-week history of fever, malaise and headache. HIV positive. Okay, fever, malaise and headache. Early in the morning, her friend has stopped to check on her and found her confused and disoriented, brought to the emergency department. Yes, altered sensorium, confusion, HIV positive, headache. Physical examination, she is lethargic, her heart rate is 70, blood pressure is low, her temperature is high, little high, her CT is unremarkable. Other finding, CSF, lymphocytes, glucose is low, less than 45, protein is high, so less glucose, more protein, lymphocyte. And CD4 count is 87, very low, highly immunocompromised. After 3 days, yeast is identified. Now your job will be easy. Not easy because if they ask which organism, you can tell Cryptococcus. Now they give the clue, it is Cryptococcus. Yeast is identified. Okay, which are the following most likely seen microscopically on the CSF? In CSF, which one you are going to find? Budding yeast with broad base is blastomyces, figure of 8, broad base budding. Budding yeast with hyphae and pseudohyphae, always seen in Candida. Clusters of yeast with short hyphae, spaghetti meatball appearance. We call it as Malassezia furfur. Malassezia. Encapsulated, yes. Ovoid budding yeast. It is nothing but Cryptococcus neoformans. It's nothing but Cryptococcus neoformans. And one more question. What is the primary focus of this man's infection most likely? What is the primary focus of? So where the person got the infection, what is the primary focus of this infection? What is the mode of transmission of Cryptococcus? Inhalation. Sources from pigeon dropping, nitrogen rich soil, eucalyptus trees. So inhalation. It go to the lungs. From the lungs it disseminate. So the primary focus is lungs. Primary focus is lungs. From there it disseminate. It causes osteomyelitis, skin lesions, European blastomycosis, many things. Yes, now the time is exactly 7:59. Exactly 1 hour we enjoyed with meningitis. Now you have some idea about meningitis, how to approach. We enjoyed some questions also. Okay, so as on time I started sharp 7 o'clock and I finished sharp 8 o'clock. Thank you very much. God bless you and see you with other topic soon. Now I am signing off. Thank you. Okay. Sorry. Just a minute. Thank you.